Good afternoon and welcome to this special Facebook Live event that we're offering during National Heart Month and that we're offering just 2 days before that big celebration of the heart, Valentine's Day. I'm Andrea Roane and I'm pleased to be hosting this with MedStar Heart and Vascular Institute. Well, as we're all very aware, the COVID crisis has been a top news story for more than a year now. We've all likely read and heard more about health issues in the past year than ever before as we look for ways to stay healthy and to protect our loved ones, our family, and friends. One of the most important aspects of the COVID story this past year has been the risk that it seems to present for people with heart disease or heart-related risk factors. And we're learning more now about possible long-term effects on the heart. Well, as we start a new year and move through National Heart Month, now is a very good time to talk with the experts about COVID and heart disease, what we know, what we still need to understand, what it means for you, and how you can continue to strive for a healthy 2021. I'm pleased to welcome two physicians today. First, Dr. Barbara Srichai, a board-certified cardiologist with MedStar Heart and Vascular Institute and the vice chair of the cardiology division at MedStar Georgetown University Hospital, and Dr. Ajeet Vinayak, a board-certified in intensive care and pulmonary critical care, and he is the director of the medical ICU at Georgetown. Also with us today is Karen Zengel. Karen is Senior Director of Interactive Marketing for MedStar Health. She will be reading through the questions you submit to us today. And at the end of my quick conversation with the doctors, Karen will share some of those questions and we'll try to answer as many as possible during the time we have together. So let's not waste any time. Let's get right down to the questions. Talking about the risk. Are people with heart disease or other heart-related conditions, risk factors, at higher risk of developing COVID? And we'll start with you, Dr. Srichai.
Hi, Andrea. Thank you again for hosting this series. And I'm pleased to be here with you and with everybody out there to talk about this important aspect of COVID that we're just learning more and more about. First, let me talk a little bit about what we mean by heart disease and what we mean about risk factors. When we talk about heart disease, we talk about anything that can affect the heart. We often, I think what most people think about are heart attacks because that's probably what most people are most scared about. And that's often referred to as a disease of the blood vessels that supply the blood into the heart muscle. And if one of those blood vessels gets blocked, it can lead to a heart attack. But there are other aspects of the heart that we refer to as heart disease. So the muscle itself can be directly affected and can lead to weakening of the muscle, which then can lead to a condition we call cardiomyopathy. Anything can affect the electrical system that causes the heart to pump, and it can cause your heartbeat to go slow or fast. We've heard about patients needing pacemakers because of a heart condition. The other things are the valves that are within the heart that help direct the blood flow going through the chambers of the heart so that everything goes in the right direction. And some people are born with what we call congenital defects or abnormalities within their heart system that causes the blood to go maybe in the wrong direction or things to malform that then can lead to problems later in life. Now, that's when we talk about heart disease, we're talking about an actual problem that pre-exists inside the heart. When we talk about risk factors, though, we're talking about, technically it's not heart disease. You don't have heart disease just because you have risk factors. However, these risk factors can then lead to the development of heart disease. And so we want to catch people who have these underlying risk factors to prevent them from developing heart disease. And these risk factors, most of you are aware of the more common ones. They include diabetes, high blood pressure, high cholesterol, excessive weight gain. There's no evidence, though, that patients who have heart disease or patients who have heart risk factors actually can catch COVID more easily than a person who doesn't have these risk factors. I think the more concerning thing is that because of these underlying risk factors and because you may have heart disease, if you were to contract COVID, the consequences could be worse for you compared to somebody who doesn't have these underlying conditions.
Why is that the case? How do these risk factors actually affect the heart and put us at greater risk for COVID?
That's a great question. So when we talk about these risk factors, we're talking about things that just make it harder, that can put a strain on the heart, on how the blood works, how the blood flows throughout the body, how it flows through the heart. chambers, and anything that can put a strain on the function of the heart can then lead to heart disease. So we know over time, patients with diabetes, high levels of sugars can put a strain on the blood vessels, create plaques to form in the blood vessels, blockages can build up. It can also affect the heart muscle and the nerves that supply the signals to the heart in terms of when to contract or not. In addition, obesity, we know, is a rising pandemic additionally, but also contributes to the development of diabetes and high blood pressure. But separately, it can also, we're finding information that shows that excessive weight itself can also put a strain on the heart muscle, which then can lead to heart failure.
You know, we're hearing about the cardiovascular risk factors, but again, in relationship to COVID, the greater risk of severe illness, why is that with COVID and these risk factors?
So that's a good question as well. So we know, for our body to function, we need everything to be working in tip-top shape. Our hearts need to be as in tip-top shape, our immune system, our lungs. And so all of these systems act together to help us fight off infections such as COVID. Having heart disease or these risk factors, or being not having good control of your high blood pressure or your diabetes, as I mentioned already, can put a strain on the heart. But then because the heart is under strain, because our immune system may already be under strain because of these underlying illnesses, when then it's attacked by an outside system such as COVID or any other kind of infections, that then just impounds the stress on the body itself even worse so. And so then I think those are all the reasons why we're seeing these complications, particularly in our patients who have underlying heart disease or these risk factors, particularly if they're not well controlled.
So we've been talking about seeing COVID in the news for more than a year now, and you're talking about stress and inflammation. It's kind of tough to reduce the stress when you have it being bombarded at you from all sides. So putting that under control, getting that risk factor under control, is a major step toward not getting sicker from any of the diseases that we're talking about. So you've given us some background on risk factors in heart disease and whether we get sicker or not from COVID. The question now is COVID a respiratory disease that affects the lungs as originally thought, or is it one that affects our heart and blood vessels?
That's an excellent question as well. And I'll start with my answer, but we have Dr. Ajeet Vinayak, who I would ask to comment as well, being our medical ICU director here at Georgetown. So as you mentioned, COVID's been around for over a year now. And as you mentioned, when we first were encountering the disease, we thought it was primarily a respiratory illness because a lot of our patients were having difficulty breathing, shortness of breath, needing oxygen. Now we've learned a lot about the process, and it seems that it's not just a respiratory disease, it's affecting nearly all the organs within our body, and trying to figure out why that is and what that link is that causes it to have such wide-ranging effects. So we've mentioned about the lungs, we've mentioned about the heart. It also affects the kidneys, it affects the blood vessels, it can affect the skin and the GI tract. A lot of this is thought to be mediated by widespread inflammation and the development of blood clots. And so researchers are just trying to understand this a little bit better so that we can better handle what we're seeing, how it's affecting the body, how it's affecting different people's bodies, and what we can do to best target that. And we're already seeing new therapies coming out even more recently, both in our inpatient as well as our outpatient setting.
Dr. Vinayak, do you want to contribute as someone with an expertise in pulmonology?
Yes, thank you so much, Dr. Srichai and Ms. Roane. It's great to have a chance to share information about COVID and health and the consequences of it. There are lots of questions and answers still out there about COVID, and certainly even this week, breaking news coming from the NIH frequently about how to manage it. And a lot of the management is focused at the vascular system. There's a lot to suggest that it is more than just a respiratory disease. Scientists call it severe acute respiratory syndrome, CoV-2, or SARS-CoV-2 is the long name for COVID-2, but it's not just a respiratory virus. Just like the flu, inflammation that occurs when you have a significant virus affects everything, as we've already heard. And in fact, even when we see the lung as the predominant site of the injury, people coming in short of breath, requiring lots of extra oxygen, it's not even just the spongy part of the lung that gets affected, but it's the blood vessels. We're recognizing this, unfortunately, when we see pathology in the lung after people have expired from the disease. And when you look, you see that the blood vessels are affected frequently with clots. This occurs in any severe illness, including the flu. But when you look at the effect of flu on the lung versus coronavirus, COVID-19, what you'll see is that there's 9 times more clots, even in the small vessels. Up to 25% of the patients that come into the hospital will have evidence of large clots, either in their lungs or legs at some point. And that probably underestimates the amount of small microvascular clot that occurs in small vessels beyond the detection at the bedside. And this effect isn't just, and it's caused some people to actually redescribe the severe respiratory disease, and rather than using terms such as acute respiratory distress syndrome, actually calling it acute vascular distress syndrome, even in those patients that have severe oxygen needs in the ICU. And it's not just the lung and the heart that gets affected, but it's the entire cardiovascular system, including the blood vessels of the brain. We've known for a while that severe viral infection leads to neurologic complications. Of the 12 major flu pandemics, epidemics in the last 2 centuries, there's been a constant report that the brain can also be affected. Now, the initial Spanish flu of 1917, as Dr. Tornatori, the head of our neurology department, likes to remind us, was associated with Parkinson's syndrome. That hasn't been consistently found in other viruses, but there has been some suggestion with more recent flu strains, such as the bird flu and swine flu, that there may be more neurologic complications. It's definitely the case that the data seems to be pointing that the brain gets involved with COVID-19 at an extraordinarily high rate. As someone that staffs both medical ICU and the neurologic science ICU here, we see strokes in ICU patients in all of the units. Those people that are in the ICU have maybe as much as a 1 in 16 chance of developing stroke. And that's just in the severe inpatient population. Stroke seems to be prevalent even in the outpatient population. And the result is due to direct brain inflammation, but also the cardiac insult that leads to the same risk factors for the heart that Dr. Srichai mentioned are the same risk factors for stroke. And then if you do have cardiac abnormalities, such as valvular disorders or having a low flow of blood, that of course can, if you're already at risk for stroke, precipitate a stroke. But there's probably direct injury to the blood vessels themselves and the nerves themselves as well. I think we're all kind of aware of that, because one of the most common presenting symptoms for COVID-19 is that loss of smell, that loss of taste. And that is a neurologic and nerve injury. But it also affects the blood vessels, and stroke does happen. And the rate of stroke is significant. It may exacerbate the rate of stroke in those patients with risk factors. And there's even unfortunate data that certain racial profiles might be more affected with consequences, long-term consequences of stroke. The Black American population in particular seems to be at higher risk for having more prolonged complications after stroke.
Doctor, are we seeing a difference in stroke as far as age is concerned? Because I know we've all heard the stories about how younger people are being diagnosed with stroke and symptoms. And what do we do what are the symptoms, and is it, whether it's COVID related or not, how do we react?
That's a great question. You know, I think that there is some suggestion that stroke can be, especially more severe presentations of stroke, can be seen in young patients, but that's still the vast minority, younger patients. I think those people at risk for having stroke, and the ones that we see more stroke in, still remain those patients with these classic risk factors that occur at older age as well. And the symptoms, the mnemonic FAST is one that I think everyone should be familiar with. And it stands for, if you have signs or symptoms of facial drooping, arm weakness, the A is arm weakness. If you have difficulties with speech, or if you notice someone having either or any of those three, face, arm, and speech, then T is time. As quickly as possible, notify, seek medical attention. Some people have used BFAST. BFAST adds the B and the E, which is balance or leg weakness, eye changes in eye motion, or visual changes. But FAST or BFAST is very important. And acknowledging and seeing that you have stroke and seeking medical attention is really important. As part of that, I'll tell you that in China and across Europe last year, when COVID was at its highest point, there actually was a reduced rate of admissions and calls for stroke, which seems kind of the opposite of what I just said. But probably the issue was because the hospitals were so full, because there was partitioning of care there, and because people didn't want to go to the hospital, people weren't responding to some of these symptoms. And and what we're seeing when people are in the hospital is that stroke happens, and we should be careful about trying to avoid coming to the hospital, especially if you have any of the cardiovascular, heart, or stroke symptoms that we're talking about today. Seek medical attention. The consequences of stroke are long-lasting and significant and lead to significant debility.
Isn't there a drug too? You were talking about time, the time to call 911. Should I try to get myself to the hospital? Should I wait for the medical personnel? Because I understand there's a drug that can be administered to minimize some of the effects of stroke. But again, it's based on the time. How much time are we talking about?
Certainly, we talk about the golden hour of everything, but certainly within the first 3-6 hours, that's when we want to think about using medicines, if appropriate, for attacking those blood clots that are lead in those narrowed vessels that are causing the stroke symptoms, and seeking medical attention. And if you're unable to drive, calling 911, getting an ambulance, having someone as quickly as possible get you to an emergency room to be evaluated for, is this a stroke? Is this the type of stroke that, as Ms. Roane is alluding to, responds to TPA, this clot buster, that we should administer within hours of stroke symptoms to get the best effect and the least residual long-term consequence is very important.
You've been talking about the risk factors and the severity of COVID based on someone who might have some of these risk factors. You've used the term inflammation. Talk to us again about inflammation and how it plays a role in heart disease and stroke. Dr. Srichai, would you like to start?
Sure. So I think, as Dr. Vinayak has mentioned, inflammation can affect the blood vessels, and we think that a lot of what we're seeing is related to inflammation in the blood vessels with the development of the blood clots. He also mentioned about the virus directly affecting the brain. The virus, there's been studies showing that when we take a look at the hearts, the virus is not just limited to the lungs, thinking this is a respiratory disease and it's mediating everything else. They actually find virus in the heart as well. And it's thought that inflammation in the heart muscle, so outside the blood vessel, but in the muscle itself, is also contributing to some of the signs and symptoms that we're seeing, the heart effects. I believe there was a study that showed that in patients who were hospitalized, probably about 50% of them actually had some signs of heart involvement, most likely either through blood clots or blood vessels or from inflammation that then could be affecting the electrical system, causing the tachycardia or slow heart rates, and we've seen both. But actually, there's a recent study that has come out looking at patients who've recovered, not necessarily hospitalized, but has shown that when you look at the hearts in a careful manner, there's probably closer to 70 to 80% of hearts that have become involved with some type of involvement related to having had the infection. And what's interesting is that this is like 2 to 3 months after patients who've had the initial symptoms of COVID that this study was performed in. And in about 50% of those patients, there was still evidence of ongoing inflammation in the heart itself. And that's just one organ. My guess is that what it's doing in the heart is not limited to the heart, that this is widespread, and it could, the same similar kind of inflammation may be happening in other parts of the body. But that's a pretty high number. And
Yes,
now, does that mean that everybody's going to have heart disease down the road just because you've had COVID? I think we don't know that. It might be just very minor involvement and we're just seeing it, and that it may clear up. And just like, you have a cold, you have a runny nose, your runny nose clears up and you're back to normal. And hopefully for most of the patients, that's what's going to happen, because 80% is a pretty high number. But it's important not to ignore, if you have had a history of COVID and you have signs or symptoms that could suggest some type of underlying heart or lung complication, that you get checked out. So symptoms that you didn't normally have before you developed the infection. So shortness of breath, chest pain, fast heartbeats, and I've seen like the gamut of types of symptoms that could possibly be related to the heart. It's important that you don't ignore these symptoms, because there are, if we know what's going on, and if we see that there's evidence that it is damaging the heart, we want to be able to address that as quickly as possible to prevent as much damage. As you mentioned about this time issue with stroke, it's the same thing with the heart. As early as we can address things, we would like to minimize the amount of long-term damage there could be on the heart.
Absolutely. So some takeaways. How do we prevent some of these, lower our risk for developing heart disease, the risk factors, and developing COVID? What should we be reminded of doing to stay healthy and have that healthier 2021?
Well, it's before COVID, we were always marketing, or putting out, making sure everyone was aware, increasing awareness how important it is to control your risk factors. As I mentioned, the risk factors don't mean you have heart disease, but having these risk factors, if they're not controlled, means that your risk of getting heart disease, it just increases. So if you have diabetes, watching what you're eating, exercising, keeping your weight under control to keep the diabetes under control. If you have high blood pressure, again, the same sort of healthy lifestyle changes. If you need medication to keep the blood pressure under control, then taking the medicines so that your blood pressure stays under control. And as we know, these are all also risk factors for stroke. So we want to keep that under check, as we had just heard that stroke can be a very devastating acute complication that we're seeing if you get infected, not even just with COVID, but just in general. I think, and as I mentioned, keeping your weight under control, eating a balanced, heart-healthy diet. I think those are all sort of the things we've been preaching. With regards to infections and COVID, so trying to minimize our risk of acquiring the infection. As I mentioned, having heart disease or risk factors doesn't increase your likelihood of getting the infection. It just makes the chance of having a more severe infection higher compared to somebody who doesn't have these underlying risk factors. But what can we do to minimize our risk of getting COVID? And this is part of our whole public health initiative. So staying 6 feet apart from people, trying not to gather in large crowds, particularly indoor locations, masking. Now they're talking about double masking, making sure to minimize, again, your risk of inhaling the respiratory droplets that are leading to COVID. And now with these new variants that are out there, we're going to have to continue to just keep getting smarter about these methods of avoiding getting the infection, and try to avoid, I guess what I've seen is just fatigue. Like we're not probably as diligent as we were at the beginning of the pandemic in terms of making sure we wash our hands, keeping everything clean, and making sure our masks are tightly fitted.
Dr. Vinayak, talking about the vaccine, there are people who are still concerned about getting the vaccine. They're worried about it. Maybe it was rushed into production too soon, whatever. What do you tell your patients? Have you had the vaccine? How you share your experience?
For sure. The vaccine, I may have been the third or fourth person in line when it came out here to get it. I've gotten my vaccine, the two shots. I had the first one, the Pfizer vaccine. My patients in the outpatient world are patients with significant lung disease that won't tolerate this very much. Some of them have immunocompromised states. Their immune system is already affected, and I endorse getting the vaccine. The best way for us to return to normalcy, to get back to a healthier 2021 and beyond, is for more and more people, as much as we can get from the government vaccines into people's arms. And that's why I did it, certainly so that we can be healthier. We've heard horror stories of outbreaks in some hospitals on floors with COVID. And when you look at it, unfortunately, it's the healthcare workers that, for whatever reasons, haven't had the vaccine yet or have chosen not to have the vaccine. So certainly as a healthcare professional, it makes sense, but it makes sense for everyone to get the vaccine so that we can all be safe and safer going forward, certainly.
Do you agree
I
with
just want to make
Dr.
sure.
Srichai that we're a little fatigued about this and we may get complacent with the vaccine, thinking, I have nothing to worry about?
I hope not.
I hope not. Yes, I hope not either. But similar to Dr. Vinayak, I too have gotten the vaccine. I was actually a little bit hesitant, so I was not second or third in line. And a lot of my staff here had a lot of questions, and I'm sure a lot of our viewers had questions about this vaccine, about these vaccines, just with how quickly they came out. And so I did what I do in my everyday thing when I'm unsure about something, is I looked up the literature and I did research on it, and I tried to address some of the concerns and questions that my staff here have. And going through peer-reviewed journals, what types of patients that they tested the vaccine on and what the side effects were. And then I've been just applying that knowledge to both our staff here, half of which said they would not get the vaccine. And now after listening to everyone's stories and understanding a little bit better about how the vaccines work and how it was tested, all of them have gotten vaccinated up here. So I think vaccine fatigue, I don't think we have vaccine fatigue at this point in time. I do have a lot of patients who are very still hesitant to get the vaccine, worried about reactions. I say you have to weigh that against the risk that you may get the virus, and the reaction you may have to the virus, given your underlying heart disease or risk factors, could be a lot worse than the risk of having the vaccine. But it's a personal choice, and I'm not going to force my patients to get the vaccine. But I am on the side of, I think the more people who gets the vaccines, the better we are equipped to eradicate this pandemic, actually.
And obviously we've had some effect with the masking, the washing of our hands and whatever, because we're not talking about flu this year as we have in years past. We're talking about COVID, but we've been reminded to get the flu vaccine. And obviously some of this distancing is working as far as that is concerned. So we know it makes a difference.
Yeah, for sure. Even in the hospital, we've seen, the practices of masking and washing hands frequently, reducing infection rates in the hospital. And yeah, we have yet to see the flu come out in full force this year. A lot of it may be due to the social distancing, and as Dr. Srichai mentions, and as you do, Ms. Roane, but that doesn't mean that we're not going to get the flu. Oftentimes in a year, the flu can be later into the winter and even into the spring season. So we are still recommending that everyone please also get the flu vaccine as you normally would.
But I think you're right. It's a testament to that these processes are working, because usually we see a huge spike in flu cases around this time of year, and we have not seen that. And I think, like you mentioned, it's a testament to the fact that masking, social distancing, and hand washing works.
Sounds good. We've been having a great conversation, but we know our audience is excited to get involved in this and ask their questions as well. So we're going to turn your insight into the hands of Karen Zangle, who's been monitoring those conversations. Karen, what are they asking of our doctors?
Well, first of all, thank you to all of our viewers who are watching right now and posting their comments. We have folks from all over the area who have been joining us since the beginning of this broadcast. So thank you for watching, sticking around, posting your comments, sharing this broadcast with your friends. Thank you to the three of you for being here today and for our experts for bringing this information. We're getting a lot of wonderful comments just about how thankful our viewers are for the information that you're sharing with them today. And we actually had some patients of yours who have commented and shared their thanks for everything that you have done for them and for patients. So wanted to share that before I get into a few questions that have come our way. We're also hearing from some COVID-19 survivors as well. So thank you all for watching and sharing your stories. I know as you were talking about the vaccine, the more and more people are talking about it, the better we are as a whole and learning what's going on with this pandemic and with the vaccine. So it's wonderful to hear from you all. We did have a few questions that I wanted to share with you now. The first is going back to our COVID survivors. If they don't have specifically heart disease or underlying condition, what do those of us that just had COVID-19 need to keep in mind when it comes to our heart?
Well, I would say, I'm assuming they're asking that question of me as the cardiologist. So I think one thing that the COVID pandemic has brought out is that we are seeing it in patients who don't have any history of risk factors or heart disease, but maybe might be bringing out some subclinical factors that they weren't unaware of. And so again, I think it's just still important that if you notice any change in your symptomatology that you think might be related to the heart, it's important to talk to your PCP, maybe get a referral to a cardiologist to make sure it isn't your heart, because I've seen several patients who have no history of heart disease, maybe a risk factor here and there, who have new symptoms, mainly shortness of breath, or it could be tachycardia, or just not really getting back to the state they were in before COVID. And it's important to check out what's going on in the heart, because it's very hard to predict. Is this something, is this just deconditioning? You know, you've been out of commission for several weeks and it just takes a while to kind of get those muscles back in shape? Or is there something more serious going on in your heart? And we've seen a mix. Thankfully, a lot of them have been, it's more deconditioning, but we have seen heart disease that has popped up in these patients. So I think it is important to make sure you get checked out by a healthcare professional. I think the other thing is just trying to get back to the state that you were in before you had COVID. And I think that's a good sign. If you're able to go back to kind of like the things you were doing before, your blood pressure is good, you don't have diabetes, I would say you're probably good to go.
You know, if I could just add to that, you know, I was talking with our nutritionists about COVID, and they did bring up after having COVID, you know, we talked about the nutrition and having a balanced diet. But one of the big problems that patients have is after COVID, getting back to that state of adequate nutrition. For one, the GI tract is often infected. People will feel less hunger, but it's so important to continue to try to have that same balanced and adequate nutrition for recovery as well. And part and parcel with nutrition, as a pulmonary and sleep doctor, sleep is probably one of the most important ways of mitigating inflammation, decreasing inflammation, and controlling inflammation. So sleep as a preventive method and afterwards, after COVID, is very important too, finding ways to rest and sleep. Specific diet things that also probably should be considered, and Dr. Srichai, please add to this, but canned and packaged foods are very high in salt. Look for those things that are lower in salt content and added salts and sugars. So packaged foods and canned foods in particular are things to be a little bit more careful with.
I think the other thing is trying to eat more whole foods and less processed foods. And so as mentioned about the prepackaged foods, often have more preservatives in them as well. So trying to minimize that, because that could, we don't know, but the diet could lead to worsening inflammation.
That is wonderful information. Great tips. Thank you so much. We have a question from Talia, and thank you, Talia. She asks, is a child who had a heart ablation for WPW a higher risk for getting COVID-19? And I'm not sure what WPW is, so if you guys know, I'm sure you do. Could you help our viewers better understand that and help Talia with her question?
Okay. So first I want to again emphasize, just because you've had heart disease or you have a risk factor, that doesn't increase your likelihood of getting COVID. That's like the masking and social distancing. Those are all the ways to mitigate getting COVID. WPW is a condition called, the official name is Wolff-Parkinson-White syndrome, and it affects the electrical system in the heart, which I mentioned can cause, if the electrical system's affected, it can lead to slow heartbeats or fast heartbeats. So now we're talking about the heart rhythm, the signals that it sends to tell the heart when to beat and how fast to beat. An ablation procedure in the past, as a child, actually shouldn't, it's almost considered a curative procedure, and that by itself I would not consider a risk factor for having a more severe consequence of having an infection. So I wouldn't put that in the same category as somebody who has even the risk factors, diabetes and hypertension, that's not controlled. There has been something that's been done to the heart, but it's basically been fixed, is what I would say. And so I wouldn't consider it to be a long-term risk factor for having more severe complications of COVID.
Okay, thank you very much. We have a question from Mimi. She asked, should you take your normal medications before receiving the vaccine? So I'm guessing if you're on some type of heart medication, would you just continue to do that before you get the COVID vaccine?
I can't think of any contraindication. Can you, Dr. Srichai?
No, I can't think of any. I mean, I think if you've recently had a vaccine, though, that is you have to wait. I don't remember if it's 14 days, but so if you're getting the shingles vaccine, you can't get the COVID vaccine the next. I think it's at least 14 days, if I remember. I don't know the exact guides, but in terms of medications, you should continue to take your medications, because that's what's going to control your blood pressure and your diabetes. And we want to make sure that that's all under control, and that you're in the tip-top shape for when you're getting the vaccine.
Okay, thank you very much. We also wanted to talk a little bit about, we mentioned earlier briefly about the new guidelines for wearing 2 masks instead of 1. What is your advice regarding masks, wearing 2 at this point?
Should I go first?
You can go first.
Yeah, I think Dr. Fauci's comments last week are really based on concerns about variants that have a higher rate of potential infectivity. It's not necessarily based on hard data, but it kind of makes a lot of sense that double masking, especially if this new variant bears out more, is more protective. It also allows for a snugger fit, and certainly provides a little bit more protection with the surgical mask closer to the skin, properly applied. If you have one that has a nose piece that can conform to the shape of the nose to get a tighter fit, snugly fit underneath the chin, and then a cloth mask in addition as just an additive barrier. Is certainly, it can't hurt. There's concerns I know about people being short of breath, but this is been shown that people's oxygen use doesn't decrease with the use of the mask, and a lot of it may have more to do with just the anxiety of double masking or masking in general.
I think the double masking, it's trying to get closer to, as he mentioned, the tighter fit that we get with the N95s that we are required to use when we're in a COVID room. But also because it's hard to tell with the cloth mask, what the effectiveness rate is in terms of how different materials cause, some work better than others in terms of blocking the virus, and having two in front, although it might make your breathing seem a little bit more short, is probably going to be more protective with blocking particles from getting through. And then again, sealing around as much as you can, and using, if the ear loops are too loose, to tighten up the ear loops, making a knot in the ear loop, or I use some Velcro to tighten up the back, so that way I have more of a good seal around the sides, because any kind of opening, the viruses are smart and they can get in through there.
I have a question, advice for making it fun for our younger kids to wear the mask. They're hardest to convince, as well as some older people.
It's some
Any
character.
advice?
I could give some advice as a mom of twins that are 5. My daughters love wearing masks that have their favorite character on it. They love their LOL surprise masks. They actually, we had them pick out their own mask online so they could choose the pattern that they wanted. And I felt like that really helped. And we also got one for their dolls. So they put their mask on their dolls and they have a matching one. And that's made it fun for them, because they are required to wear one every day at preschool. So
Exactly. If we're going to get back to normal in school, we've got to at least make it fun for them to want to wear the mask and not a chore.
Yeah, I wear matching masks with my my 6-year-old.
I think we just,
Oh.
there he is. Ajeet, we lost you for a second. We can't see
Yeah.
you, but we can hear you.
Okay, I think I might have lost signal for just a second.
You did. So how,
we can hear you.
what
I
about your
was saying
6-year-old?
My 6-year-old and I try to wear matching masks. One thing that I think that's hard for her is the pressure on her ears. That's a thing. So, simple tricks like using a paper clip so that it's not connected to the ear for those people that have very sensitive ears, and then attaching it in the back on the other side of the paper clip are ways of avoiding the discomfort that adults and children can have. A lot of the nurses here wear headbands like this that have buttons that are easy enough to make to avoid that pressure on the ear. That's another way of at least avoiding ear fatigue. I think the hardest thing for the N95s is just the damage on the skin, and if you're wearing it for hours, just making sure that moisture doesn't develop that leads to skin breakdown.
Good advice. Karen, back to you in questions. Any more?
We have one more question, and this is specifically related to diabetes. Questions about not having diabetes before pre-COVID, then getting diagnosed with COVID, and then being diagnosed with diabetes. Can you talk a little bit more about that specifically?
Do you want to address that one, Ajeet?
I can start certainly. As mentioned in the Post article, certainly diabetes seems to be recent one just this week. The diabetes seems to be at a significantly higher incidence in patients with COVID, new diagnoses, and this is based on data and observations that go back to last year, China and across Europe, that diabetes seems to be more common. I'll say as an ICU doctor, we commonly see issues with high sugar diabetes diagnosed, but the severity of new cases and severe cases, the extreme of which is this when the diabetic ketoacidosis, which is a severe presentation of new diabetes, we've seen a good number of new cases that present that way, which is certainly evidenced and described in the medical literature. It's certainly one of the complicating things with it is that we also, some of the inflammation can cause, it leads to diabetes, but some of the medications that we're giving now in the hospital, including steroids for patients that get sick enough to be in the hospital, can contribute to poor sugar control and diabetes in the short and long term. But there certainly seems to be a connection with new diagnoses of diabetes and the virus.
I agree. I was going to mention, yeah, that you brought it up just about the medications themselves, which we've commonly seen can be associated with high sugars. And those are some of the medicines that are being used in the more sicker patients and may be contributing. But again, there's still a lot of information we don't know and trying to understand about how this disease is affecting our body long term.
Yeah. I think the Post article was referencing that the virus, we talked about how it affects the lung and the brain and the heart, but actually even that that receptor, that ACE2 receptor, seems to be also in the pancreas, which is the organ associated with the development of diabetes.
Okay. Thank you very much. And thank you to all of our viewers for your questions. I'll turn it back over to you, Andrea.
All right, Karen, thank you very much. And I too want to add my thanks to everyone for joining us today, the audience, and their great questions. But a special thank you today to our doctors, Barbara Srichai and Dr. Vinayak, for sharing their latest information on COVID and heart disease. We know it's fluid and it's going to be changing, but they've given us food for thought and good advice on food to eat to stay healthy and lower our risk factors during these challenging times. Now, if you want to share the content of our conversation today with family or friends who may have missed the session, we have recorded the interview and it will be available on MedStar Health's Facebook page this very afternoon. We also had a few questions today that we didn't have time for to address, and we will use those to create additional Facebook posts and blogs. So watch for your questions to be answered in upcoming communications from MedStar. MedStar Health offers frequent Facebook Live events on a wide range of topics. So check out their Facebook page for upcoming topics, date, times, and speakers. We want to thank you again for being with us today. We wish you all the very best this National Heart Month and a happy Valentine's Day to everyone. Love your heart, love yourself.
Thank you all. Thank you, Ms. Roane.
You're welcome. Bye-bye.
Everyone.